Hi everyone, my name is Noopur Swadas. I'm a fourth-year undergraduate nursing student at the University of Calgary. In my study, I assessed the background knowledge and attitudes of pharmacogenetic testing among nurses to better understand some of the barriers preventing this testing from being integrated into clinical practice. Pharmacogenetic testing is the use of genetic testing to guide the selection of a patient's drug therapy. This form of testing allows physicians to select the optimal medication for their patients with the goal of minimizing adverse reactions. Each year, there are an estimated 200,000 people experiencing severe adverse reactions in Canada and 22,000 deaths from these reactions. This test has the potential to significantly reduce mortality from adverse drug effects. However, despite the benefits, it is not widely utilized due to barriers integrating it into clinical practice. Clinician knowledge and attitudes are part of the reason for this delay in implementation. RNs and NPs specifically contribute to the slow progress due to their lack of education and training in pharmacogenetic testing. A study conducted in the United Kingdom found that a major challenge for nurses was to explain results from pharmacogenetic testing to patients due to a decreased understanding of pharmacogenetics. There is limited knowledge base for pharmacogenetic testing due to its novelty that may influence nurses' cognition and attitudes towards using it in clinical practice. This study is going to be the first of its kind, as there is no official analysis of knowledge and attitudes of nurses concerning pharmacogenetic testing in Canada. This project is conducted in collaboration with Dr. Van Riper from the University of South Carolina, who has conducted a similar study in the United States. The study uses a multi-question online survey which was created by Dr. Van Riper for her previous study, and it addresses knowledge and attitude-based questions concerning pharmacogenetic testing. The survey questions for this study have been modified and updated to include new advances in pharmacogenetics. A social media recruitment campaign was launched to recruit survey participants. 3 social media platforms, including Instagram, Twitter, and Reddit, were used to share online posts with the link to the survey. An unexpected finding from the study was the effectiveness of social media recruitment, particularly Reddit, in recruiting participants. There are a limited number of studies which focus on the success of Reddit as a social media participant recruitment tool for research. However, to our surprise, we were able to recruit more than 50% of our participants from Reddit alone and discovered its effectiveness for research recruitment. Survey responses were collected and analyzed through IBM SPSS statistics. Descriptive statistics were generated for all respondents as a group, including frequencies for categorical variables and means for continuous variables. We had 236 participants, including nursing students, registered nurses, and nurse practitioners, complete the survey. Responses were received from all provinces in Canada except Nunavut and Newfoundland and Labrador. Our results showed the majority of the respondents, specifically 65.9%, had no education in genetics or genomics, while 34.1% did have an education. Of the ones that had an education, only 17.2% had taken an undergraduate genetics or genomics course. 40.7% of the participants had a poor understanding of genetics, and about 72.9% had a poor understanding of pharmacogenetic testing. Our findings show that a majority of the participants believe pharmacogenetic testing will help to decrease the number of adverse reactions. The majority also display an increased positive attitude about the use of pharmacogenetic testing. More than 50% of the participants were interested in learning more about pharmacogenetic testing, with the majority wanting to have a web-based course or seminar lecture. To conclude, our findings suggest that there is a lack of knowledge among nurses regarding pharmacogenetic testing. However, there is also an increase in positive attitudes and desire to learn more about this field. This study indicates that nurses need to feel more comfortable educating patients regarding genetics and pharmacogenetic testing. The findings have the potential to increase future learning opportunities in undergraduate or graduate programs and increase overall patient outcomes. This study is planned to contribute to a global project comparing the knowledge and perspectives of practicing nurses and nurse practitioners between several countries, including Canada, Israel, and the United States. We hope that the global study will have the potential to drive the construction and redesign of nursing policies and education to aid with the implementation of pharmacogenetic testing.
I would like to extend my heartiest thanks to my mentors, Dr. Sarah Duell and Dr. Sandra Davidson, who offered me continuous support and encouragement to not only succeed in this project, but also for my future endeavors.